Good morning, Jay. This is Jay Culver with Global Media, and you're on physical therapy diagnosis. Can you tell me a little bit about your technology?
Morning, Tim. Thanks for coming in. This is actually the mobile video cart from Global Media. We feature a number of different video technologies, and this is actually designed for a telemedicine application. What we have here is we have two screens. You're seeing a feed from a video camera, which is actually up here, featured by one of our manufacturing partners, Polycom. We're an arena partner with them, and we've partnered manufacturer to manufacturer to make sure that all these solutions work together in a seamless fashion. But this video screen actually is showing what's coming from this camera. So you can, for a physical therapy aspect, you can see gait. You can track with the patient. I can actually use a remote to track the patient, use the far end. So a physician on the other side of the video call, whether they're in the next city, the next state, the next country, you can connect with folks, much like people do with Skype with their grandkids.
And Jay, this cart looks like it would be set up in a hospital setting or a clinic, maybe an outpatient physical therapist clinic?
Exactly. This would be positioned at a clinic somewhere, and then you can connect back to your physicians. You can either have a physician, a mid-level, and they can be reviewing that, and the far end, again, who's doing the actual specialty consult, can discuss with the patient. We've got speaker bars here, so you can have two-way audio, two-way video. You can see with the camera, we can bring in medical records.
Medical records. Okay.
We can pull up a lab. This is actually our image capture software, so we're looking at various things like we've got the skin.
And that, Jay, is the camera you're holding in your hand right there.
Correct.
That wand is the actual camera. It's lightweight.
Lightweight, easy to use, easy to hold. You hold it much like a pen. This is called the Total Exam Camera from Global Media. It hooks up to either what we call a video codec, which has a video signal, or it can hook up to something as basic as a laptop or a netbook, possibly even a tablet that has a USB connection.
And Jay, physical therapists in the outpatient setting could use that camera to assess a patient's gait?
Absolutely.
And we could record the patient squatting or kneeling. And Jay, can you talk about how we could use the device for documentation? Has that been done in the medical setting already?
Well, you know, it's interesting with the documentation piece. It's said that a picture is worth 1,000 words. So we have our image capture software that for demonstration, the eye is typically the best way to get the image.
Let's get in a look. So that is your eye on the
This is my eye on the camera. I used the Total Exam with a derm hood on here. But now with this camera, I can actually, prior to coming into this, we can run a query off of the patient record, whether it's in PACS or somewhere else. So I can pull by.
And I'm sorry, Jay, you just used the term PACS. P-A-C-S?
Correct. So the Patient Archive and Communication System.
Right. Okay.
So much like for the X-rays, MRs, but this is a visible light image. So this is very different, much like what you're seeing.
Right.
And so we can pull this up, and now we're able to give you evidence of the consult, any complications that you may discover.
Right.
You know, wow, I can actually code for a more in-depth examination.
A more complex code. Right.
Right. So this image actually can be saved in what we call a DICOM format, and then incorporated into a health record, incorporated into a presentation or a case note.
Very good. Jay Culver with Global Media at the American Telemedicine Association Annual Conference in Tampa. Thank you, Jay.
Thank you, Tim.